Joining us now is former CDC acting director and current president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. Good morning, doctor.
Good morning. Good to be here.
There is still Omicron concern in China, and I'm just wondering where we are. Things seem to, improve here, and then we look overseas and things get worse again. Where are we?
Well, Larry, we clearly are not out of this pandemic until it's controlled everywhere in the globe. And one of the things that I'm very concerned about is that the global efforts, the efforts to vaccinate people around the world have been declining. And the support here in the United States for those global efforts is declining as well. I worry. We all want this pandemic to be over. We want to get back to our regular lives. But until it's controlled everywhere, it's going to be hard to do that. We're still at risk for new variants. And until we ensure that everyone in our country has access to vaccines, to testing, to treatment. You were just talking about Paxlovid. Why should it be the situation where how much money you make or whether your job provides good health insurance should determine how you do in this pandemic? We can't let that be the case.
And how does the winding down of the COVID emergency support that we saw so ramped up during the height of the pandemic, how does that affect people who are on Medicaid?
Yeah, Robin, it's a big issue. It affects people who are on Medicaid. The expectation is that if the public declaration of a public health emergency ends, and right now it's extended to July, if that ends and other actions aren't taken, there's as many as 15 million people who are on Medicaid who could lose those Medicaid benefits. There are millions of other people who've been getting assistance in buying insurance in the marketplace who could lose that insurance. There are people who are getting telehealth services for mental health and other medical visits who wouldn't get those because they're only paid for because of the public health emergency. We need to make sure that as we look to wind down the emergency, we don't end the declaration until we've taken care of meeting the needs of everyone. Thankfully, the new variant that's circulating in the United States is milder than what we'd seen early in the pandemic. But there are so many people who have disabilities, who have conditions that put them at greater risk. We need to make sure that every single one knows exactly what they would do if they develop symptoms, where they would get tested, and how they'd get access to life-saving treatments. And we're not there yet.
All right, Dr. Richard Besser, we appreciate you joining us this morning. Thank you.
Thank you.
For more information, you can check out rwif.org. You can also follow Dr. Besser at Twitter on Dr. Rich Besser. Thank you for joining us.